Personal philosophy of nursing as a part of professional development. Introduction. A professional nurse is an important person in the process of treatment and care. The process of nursing is based on certain principles and theories. In the course of their work, nurses develop their philosophies, which are usually formed as a result of blending the existing theories and nurses' experiences. Thus, a nurse with some work experience should have personal ideas on the concepts of the nursing paradigm, which include a person or a patient, the environment, health, and nursing. In fact, a set of thoughts, feelings, and beliefs about those concepts make a personal nursing philosophy. Factors influencing personal nursing philosophy. After graduating from college, a nurse has some knowledge of most nursing theories and has ideas about implementing them into practice. However, in the course of practice, these ideas are influenced by some factors, both intrinsic and extrinsic, and are developed into a personal nursing philosophy. It can reflect popular nursing theories or individual ideas. It can be stated that a personal nursing philosophy predetermines the work of a nurse, her confidence, and her professional development. One of the factors influencing the development of nursing philosophy is accountability. It should be a primary concern of a nursing professional. A nurse should be able to apply the knowledge into practice with responsibility, demonstrate self-control, and be a part of a medical team. Secondly, compassion is an issue influencing nurses' development. The attitude with which a nurse treats patients is an important component of personal philosophy. It is accepted that a professional nurse should be understanding, respectful, and compassionate. Professionalism is an integral part of the nursing philosophy. It should be emphasized that professionalism is not limited to a college degree or a set of necessary practical skills. The eagerness to help others disregarding any social or economic issues is a component of personal nursing philosophy. Finally, the personal philosophy of nursing is influenced by the personal professional goals set by a nurse. Nursing metaparadigms, personal concerns. A nursing paradigm traditionally includes 4 concepts. They are a person, the environment, health, and nursing. To my mind, they are interconnected and influence each other. A person, or a patient, is a central figure in the process of care. I suppose that a patient should be treated with respect, attention, and empathy. A nurse needs to show involvement in every case. Sometimes words of support or active listening can give better results than the whole treatment. However, the task of a nurse is not only to provide care. A professional nurse is also an educator and should teach the patient the fundamentals of self-care procedures. The second concept of a nursing paradigm is the environment. It can both improve and make worse the patient's health. The environment includes many factors such as nature, society, family, ecological situation, etc. In case the environment is not favorable for health improvement, it should be changed. The task of a nurse is to find the positive sides of the patient's environment and make them work for the improvement of the patient's health condition. Besides, I consider that family is one of the most influential components of a patient's environment. Moreover, cultural and national aspects should also be considered. Health itself is a dynamic concept. It can be treated as a blend of wellness and illness and depends on the influence of environmental factors. Finally, the concept of nursing is the one that can influence the previous concepts. The task of nursing is to provide a patient with the necessary care and study the other factors which have influenced his or her condition. Thus, a patient's bad feelings can be not only the result of an illness but can also be conditioned, for example, by an unfavorable psychologic environment. Hence, the primary duty of a nurse is to minimize the harmful influences on the patient and to suggest ways of health preservation. Another idea that I consider crucial for a nurse is constant development and self-improvement to meet the needs of patients. Compatible nursing theories. I suppose that my nursing philosophy combines some ideas from famous nursing theorists. Thus, my beliefs on the role of the environment in nursing and care recall the environmental theory of Florence Nightingale. My ideas of patient behavior are connected with the self-care theory of Dorothea Oram. I have mentioned the importance of constant development of a nurse, and this component of my philosophy can be compared to Patricia Bemner's theory from novice to expert, since it is dedicated to the issue of nurses' professional growth. Another theory that is similar to my thoughts on care is Leininger's cultural care diversity and universality theory, since I believe that cultural background is essential in the process of care. Conclusion. On the whole, the personal philosophy of nursing is a subjective issue. It is formed under the influence of external factors and internal beliefs and ideas. However, it is an important part of nursing practice. In fact, it determines the development of a nurse as a professional and influences the results of nursing work.